As the discussion of mental health continues this week, the director of the National Counseling Center, Michelle Delacodre Blake, says persons should be aware of the impact social media can have on one's mental health, particularly in young persons. In an exclusive interview with ZIZ, Director Blake said social media can change a person's perspective on their self-worth and alter how persons seek validation.
And when we think of how we get validation, or how we should get validation, we get validation from people that are important to us. So we get validation from those people that have relationships with us that are close, right? But what social media does is it pushes it out into a sort of a vague place where there is an unnamed, unfaced entity that you need your validation from. And so for many young people, what it does is it takes away, it skews the reality of how to manage what expectations to have and so forth.
She said experts have established a direct link between the need for validation on social media and incidences of depression, anxiety, and other mental health issues. She also noted that to tackle these issues, there needs to be conversations with the youth and the forging of what she called real connections with people.
One of the things that COVID did was it skewed the way that people connect. Everything went to social, that virtual platforms and so forth. So we have to connect in ways that feel real and feel tangible. We have to help people, especially young people, as I say, learn to have experiences outside those that are just within the walls of the constraints of social media platforms.
Earlier this year, the Surgeon General Vivek Murthy issued a new advisory warning about the potential harm social media has had on young people's mental health, saying, quote, "We see rates of depression and anxiety and suicide and loneliness going up among people, and I'm concerned that social media is an important driver of that youth mental health crisis," end quote.